following views are those of the host and not those of Clear Channel Broadcasting licenses.
Hey, it's Leah. Hey, wouldn't it be great to hear that you could be treated for pain that you're living with every day without having to go through surgery? You could be rid of your pain without surgery, being put on addictive drugs, or even having to go through months of rehabilitation. Well, you can, and it's with Dr. Anthony Pinozzo. He has an office located in southern Palm Beach County, right in Delray Beach, so he's close enough for you to pick up the phone, make an appointment, and go in and see him. It's worth it because living in pain, like I said, is no way to go through life. And to know that Dr. Pinozzo can treat you without all of those nasty things like surgery, drugs, and rehabilitation, then why wouldn't you pick up the phone and call this number today? It's 561-381-5800. He's had nearly a 100% cure rate for lumbar pain. He's also helped thousands of people who have considered getting surgery or even been told that that is the only option, and he's eliminated that from their lives. He's gotten rid of the pain, and they never had to go through the surgery. So call him today. It's 561-381-5800. And now, here's this week's edition of the Dr. Pinozzo Sports and Medicine Hour.
Good morning, everybody, and welcome to another Sunday show with the doctor that always says, you walk in my door, limp in, jump out. Is that the way it goes?
Limp in, leap out.
Leap out. Okay. So
good morning, Les.
Hey, how you doing, buddy? Good to see you. Freddie, good morning.
Good morning. Good morning, guys.
Linda's busy over there working on the show, so we're kind of busy today. So let me give out some numbers first. 877-927-6969, and there's not a single question that you won't answer, right?
There's no dumb questions, only dumb answers.
Well, I'm going to give you a dumb question on my own.
Okay.
This is
Call in, everybody. We're waiting
please.
for you. This is your program. I mean, information is what we're trying to give out, so call in.
What we're basically trying to do is give you information to protect you, and a lot of people don't realize that what we're doing is trying to keep you away from the knife. Am I right, Doc?
We're trying to get the best treatment available.
And that's right. Okay. So let me ask you a question. I'm going to play devil's advocate, okay? Now, you might yell at me on this because I just want to be on the other side as a commentator. Why are you saying that doctors shouldn't perform knee surgery, joint surgery, and hip surgery? Why? I mean, these guys were trained as physicians.
Well, there are other treatments that they're not trained in. They're trained in surgery.
Okay.
That's it. But the treatments we do, we're trained for that, not them.
Okay. So in other words,
no, what they do is great. I mean, I don't have a problem with what they do. I'm saying what the patient needs may not be there yet, may not be bad enough, because a lot of all the knee treatments, knee problems are treatable.
Okay.
Not surgical. See, so you got to give it a chance. I mean, what does it take to get an opinion?
That's what I always say. Here's what always confuses me. I was always told, before you go under the knife, get a second opinion. I mean, I'm Jewish. You know, Jewish people get 12 opinions, and they decide out of those 12 which 4 were right, and then those 4 we get to the second one. But I'm seriously, if you're smart, is it you buy a car, you always get a second opinion?
You always try to go to the non-surgical people first, see what they have to offer you. If there's nothing to offer you, then you go to the next step, which is surgical. And but once you commit to that, I mean, you're going to lose that knee.
Yeah.
And most of them, I don't know how many percent.
96,000 a year go in for knee surgery that they should have gone in for. And that, folks, is not me talking. Go to WebMD or go to Journal of American Medical Association. They're the Bible.
Yeah. What you're pointing out is that you have to do investigation. You have to educate yourself. Mm-hmm. And everything's available at the library or online. Nobody goes to the library anymore, do they?
Are there still libraries?
Yes.
Are the books in the library?
Yes.
Yeah.
Does FSU have a library?
Yes.
Okay.
But not everybody has computer skills. Right. So go to the library, look it up, see what they're operating. They're operating ligaments, and ligaments are treatable.
Okay.
Got that? Ligaments are treatable, and that's where all the pain is. It's in the ligament structure.
877-927-6969. We challenge anyone out there, even doctors, to call up Dr. Pinozzo and get his idea what he does. Look, you know, I could sit and I could talk to him blue in the face I've seen you, and I have doctor friends. That the smartest thing I ever did was to see you before I went to get not surgery, a drug that I can't take.
Right.
Number one, and number two is a surgery that might have been performed, and also rehab. And my doctor friend told me, go to this guy. And guess what, folks? I'm walking, I'm talking, and I'm dancing, and I'm playing golf, and I got no freaking pain. Okay, so now.
Wait, Les, a couple of
Yes,
things. Today's show can be seen on Panozo.tv. Want to get that out there?
Okay,
also,
good.
shout out to timetopplaygolf.com, which is welcoming Dr. Panozo
Good.
in his video. And thank you for that. Thank you for the warm welcome today.
Thank you, sir. Appreciate
And
everything.
I wanted to mention that I heard Leah's piece
Yes.
during the week
Yes.
where Dr. Panozo took care of a young person.
Oh, that was the best. I mean, for somebody to call up the station and rave about Dr. Panozo, I was sitting there. I was like, I had goosebumps. He called up Lee to say, I listen to your show all the time, and I decided to give this man a call. I went in to see him, and tell him about it was the girl.
Tell us what happened,
His
Doc.
daughter with the bad legs or something.
It was a little girl. She 12 years old.
right.
And both knees were hurting her. But when she came in, she was wearing a knee brace.
Right. That's what the father said. Yeah.
And using a crutch.
Right.
Both of which you should not do, I don't think. Because the knee brace, if it's effective, makes it worse.
Mm-hmm.
So the better way to do it is evaluate it, which is what I did. And I told her some things to do for an exercise program, and she walked out with practically no pain at all.
Yeah.
I mean, but she's not cured by any means on one day, but it's better than what was available to her, which was therapy forever, and then injections inside the knee, which wasn't, in her case, was not the problem. The problem was outside.
Right.
The ligament structure, it was a contracture there. And all we have to do is just open it up. That's all. I mean, it's...
Did she
you have
walk
to
out?
be able to evaluate it properly.
Did she walk without the?
Yeah, she walked out
The
without
brace?
the brace and without
Really?
without the crutch.
And,
Yeah, I
that's
heard
what,
about
yeah,
that.
that's what the father said on the
I
air.
heard he was amazed. He couldn't believe it. It brought a tear to his eye.
But not only that,
Yeah.
but
It was. He was almost crying.
Yeah.
Yeah.
this is a little girl who's worried about her future. Now we satisfied her. She's not going to worry about it. She's just going to come in for a treatment, and it's going to be great. She's going to have probably 5 or 6 treatments. That's all.
Yeah, and that's what the father
Maybe
said.
less.
No, I'm less.
No.
Well, it was funny because when Leah was such a professional. She said, we always make sure that we check everyone out before we even endorse them. And guess what? I was saved the embarrassment of having to wear a foot thing for my ankle.
Boot.
Yeah, boot. When I saw Dr. Panozo, and Dr. Panozo, just was Leah talking. It was like a 4-minute. I said to myself, "Oh my God, this is what I wanted. God, it's good to pray." It made you feel good. It made me feel good, Freddie, when I heard it. Was just the best kind of endorsement you could ever get. So what I'm saying to you folks is really, this is a program that's trying to help you. We're not selling anything. We're not telling you, call in today and win golf clubs. This man does what he said he could do. So Dr. Panozo, another thing that I read is that they give, when someone goes in for an operation on the knee, first of all, they have to put him out.
Anesthesia.
Yeah, anesthesia, which to me has always been a problem with people.
That's
and
not-
also to give an epidural. What the hell is I heard that word. What is an epidural? I really don't know.
It just numbs the whole spine for a while.
Oh, a shot in the spine?
Yeah.
That's got to hurt.
It doesn't hurt that much, but it's useless. Why do it?
And you get migraines.
Really?
No,
Yeah, my wife had one. My ex-wife, and she had a migraine for 3 days.
no.
Really?
She has neck pain. That's why she had a migraine.
Well,
It
they said
can't
that a
come
little of
from
the
that.
blood spills
I
out of the
know, I
spinal column.
don't believe half of that stuff.
We
Headaches
found
come-
out that migraines don't come from the head.
No, I know that, but
Headaches
this is
come
the
from the
story
neck,
they gave
everything.
her.
Well, you got to know some stuff before you can, do that. But you'll hear a lot of stuff just to satisfy you because they have good intentions. I mean, there's
Yeah.
nothing wrong with it.
Well, why don't they just say they don't know why?
Yeah.
You know what? I'll tell you something, which is I was reading Journal of American Medical this morning, and it said that when you have when the knee part is removed, the new knee must rely on the support of the ligaments and the surrounding muscle to support the knee.
Well, I'm not too sure because
Okay.
you see, once you put an implant in there, it's made to fit together. The one goes into the bone and one fits, and it can't do anything else.
Right.
That's what you got. And usually they're pretty good though. They're all computerized and they do a nice job. Surgeons do a nice job. I'm talking about if you need to do it.
Right.
You know, they know how to do it. And I'm saying you don't need to do it that much.
That's well.
Now,
I mean,
At least
I'll give you an-
50%.
Pardon?
At least 50% they shouldn't be doing.
96,000 over
More than-
96,000 a year.
I know, but I don't want to scare anybody off.
No, more than that should not happen. Anyway, I give you an example of when you hear bone on bone, okay? All right. That does not happen because there's a cartilage there, and that cartilage is still there. It's not running around clogging up your heart. You know, when you say bone on bone, you have to say, what happened to the cartilage? Why is it bone on bone? The cartilage is there.
Right.
Well, it's the angle that they take the
right.
take the picture. And when you examine it, there's usually a contracture. In other words, that knee does not go 90 degrees out like it's supposed to. It only goes maybe 180 degrees, I should say.
Right.
So maybe it goes 170. So you're losing 10. Maybe you lose 20 degrees of extension. Okay, you can't bear weight that way. And when that happens and you step on it, you're going to bear weight in the front, which gives you patellar pain. Climbing steps is a patellar pain, not the knee itself. The patella is not in the knee, as far as I know.
Well, I would trust
the
you.
knee has several things in it,
Right.
But none of them are painful on the inside because there's no nerve fibers
Right.
that go in there.
So you
They're
never
all
give a
on-
shot. You never give a shot
they're all
directly in the knee.
No, never
Okay.
touch the inside of the knee whatsoever.
Wow.
So, but my point here was that I measured my own knee, and it was like 16 inches around, I think. And so everybody has, when you're talking about bone on bone, you're only talking about a part of the arc of the joint,
Right.
and it's in the back and on the inside. Okay, so and it only measures about 2 inches.
Oh, that's it.
That's it. 3 inches at the most. Wow. So you have 16, in my case, 16 inches, and maybe 3 of it would be a contracture. So you see, you're throwing away a perfectly good knee for what? For 3 inches of scar tissue, which is all treatable. That's the point.
What's the clicking, Doc, when your knee clicks?
Well, it's the same as this.
Hey, what is that?
It's just a ligament, that's all.
That's popping into place?
Yeah.
Or?
Just
Nothing.
tight. Find out where it pops, loosen it up.
Well, it's funny since we're on knee. We got to. Do you mind taking a couple of calls, Doctor? People have asked questions on our.
I think that's why we're here.
Okay, good. There we go.
And before you do that, 877-927-6969. We want to hear from you. Tell the doctor your story. We want to hear about pains that you've been walking around with. See if we can come up with a solution.
Well, evidently, there's a lot of people that are having pain that are.
Let's take a question on the golfer.
Oh, you wanna do
because,
the golfer one? No, that's
in
gonna be a
honor of
great
this
one.
Yes.
new site there, I
Okay.
think.
Here's a golf player from West Palm Beach, and here's what he said. I found your show on the Time to Play Golf. That's our new website. So if everyone wants to go to see play golf website, Freddie, why don't you explain what that is before I read this?
Time to Play Golf is a site that you go on there and they'll hook you up with other players. They'll hook you up with the latest and greatest.
Oh, it's a social thing.
Like a social thing, yeah. Clubs are on there, all sorts of stuff. So people go on there to get information, and
So I understand that there's no other one. We're the
no
only
other one. We're the only ones
We're the
on there
only
right
one
now.
on there.
We'll probably get a lot of company
Well,
after
we're
this
very
call.
honored. Thank you very much.
Well, because we've seen what you've done.
Okay,
with
go
golfers.
ahead,
Go
go
ahead.
ahead.
I found your show on the Time to Golf website. I was amazed at the information that you spoke about. This is a gentleman by the name of Paul from West Palm Beach. I would like to hear how you can extend my driving game, as no instructor in the past seems to help me with that. I'm in my 50s, and my shoulder and lower back seem to hurt if I push my swing longer. I've dealt with the pain for years and have adapted my playing a more solid short game. But if you can help me with my swing, then I think I can improve tremendously.
He's absolutely right. So he did a couple of things that were true. He modified his swing. He's not getting the distance.
No.
There's only one way you get the distance, and that's at the that's at the tee. And it is a medical problem. Now listen close. It is not a PGA instructor problem at the tee. It is their problem after that. because that's the art of golf after that. You don't need a full swing. But at the tee, you need a full swing. And the only way you get that is to have a good medical approach to it. It's how do you use, when you're addressing the ball, how do you get the neck, the shoulder, between the shoulder blades, the lower back, the hips and knees and ankles all to work together? That is your medical problem. It's a usage of anatomy.
Right.
That's what gives you the distance. So now in his case, he's mentioned two things.
Yeah,
the shoulder
right.
and the lower back.
Correct. Shoulder
okay,
and lower
both
back.
of those will give him a decreased distance if they don't work right.
Right.
The shoulders have to have complete range of motion, normal, before you can swing around. Between the shoulder blades has to swing well, and the lower back has to swing well. The distance is derived from both of those areas.
Mm-hmm. Sure.
The lower back has to swing. If you look at the hips, don't move that much. The lower back moves more when you're at the tee. And when that club head comes around, all these parts have to work together. Bam! And if they don't, then your club head's not going to go like this. It's going to go like this. And you're going to be off. You're going to hit it left or right, especially if you turn your wrist trying to get more distance there. Yeah, that's treatable. We would guarantee him up to 40 yards improvement.
You hear that, Paul? Up to 40 yards improvement.
Up to, yeah.
Up to.
That's the key word, up to.
I mean, if you get 20 yards, 20 yards is also a lot.
We work on it. The golf swing is complicated because there's so many parts have to work together. And the doctor's going to fix it. I'm going to fix it. I did a study I've been around Bob Tosky for a few years now.
Right.
And if anybody knows the golf swing, it's him. Mm-hmm. And then what I did was I put it together what the anatomy should be doing to satisfy his need of getting that club head down and straight. And so I broke it up into parts: the back swing, that swing, and what is involved. And I wrote it all down. I don't know where that thing is now, but I wrote it all down, like the neck, the shoulders, what each one does, all the way down on the golf swing. And we really should do a pamphlet on it,
Yeah, we should.
If I wasn't so lazy, I could do it.
No, it's not so lazy if you weren't seeing so many freaking patients every day.
The interesting thing about that, Doc, is the psychology of him approaching the game. It's like everything else in life that slows you down. He's going to be a better player because he's going to feel better.
Sure.
Right.
And even if he gets 20, 30 yards, 15 yards, whatever it is, his whole game is going to change.
His whole game's going to change, so we're going to fix that for him. He should come in. And then his attitude is going to be, but he's going to practice more.
That's right.
And so he's going to get stronger. And he's going to be able to outlast everybody else because he's going to have a normal back.
That's right. He's not going to be stressing to get the ball out
and
there.
it doesn't take that much to treat this. The way we develop the techniques we have, by the way, we do a special film that no one else does for this purpose. Mm-hmm. And we have techniques to treat these things, and we treat them in 1 or 2 days, and that's all you need.
Well, they can go to Pinoza.tv and see some of the golfers.
Absolutely. All his shows are there.
Yeah, so you go to...
There's also a commercial on ESPN I saw, Doc, where you're treating somebody in this room on back pain and lower pain, and I seen you treat the pros at, what was the name of the place, Les, that we shot that at?
Was it Boca?
No, the store, Superstore.
Oh, the Superstore, the PGA
at the Superstore,
store.
PGA Superstore on Linton. That's a little shout out.
Yeah, that was a trainer. That was a golf pro.
There was a golf pro there that he treated.
Yeah, we took that. I remember.
2 of them, a female and a male.
That's right.
Right.
And there was a guy in there named Les who's been on that commercial.
No, Les. Yeah.
I saw that commercial during the
that
playoffs.
That was the best commercial, I'll tell you.
Well, where do you see Les after he gets his shots?
Well, hopefully you can hit it a little further.
Well, the thing is about it, for the listeners, what we're talking about are true things. We don't make anything up. Make no claims whatsoever. Right. When I tell you we do it in 1 or 2 days, I mean it.
Well,
that's just a fact.
Being a golfer, okay, I was having problems with, what was that? I had problems with
your groin?
My groin and something else. And I went to see him for the first time for the first shot. And the first shot, my problem was I couldn't even bend down to pick up the ball. So when I was putting pressure on my right, I was having problems all over. I saw you.
Well, there's 5. This is information now.
Right.
This is what I'm trying to give you. If you listen to the
Right.
program, there's 5 sites in the groin that can be painful. There is an examination for every one of them, and we like to use shots because it's faster treating in that area. So there's a shot for each one of them, and they're all 100% cure.
Well, I took 2
like
shots.
You had 2 of them,
Right.
2 of the 5. And but the second one didn't show up for
Oh, the second one didn't show up for like 2 weeks after.
2 weeks after. You probably got hurt again last year, not telling me.
Yeah, well, you found it, and guess what? Now I don't have any more pain. I don't have to go for the other 3.
That shows you I wasn't looking for the old place.
No.
There's a new place.
Well, the one thing that I've heard with you after being a patient is as you said, if you got a pain here, I'll get rid of that pain. But if a new one comes, you didn't tell me about it, which I didn't. That's my fault. I'm bad. Well, now here's another one from that came off the Play Golf website. It was a guy by the name of Shane. He said, I wanted to write this because I looked at the show posted on Time to Play Golf, and he said, my left knee has an old football injury, and I don't want to go in for surgery. Can the procedure help my knee?
Now that's an interesting question.
Yeah.
Postponement of surgery, Doc.
He's postponing the
Well,
surgery.
good for him. That's good judgment.
Yeah, I think so.
Now, the knee is going to be, if it's going to be painful, it's going to impact the swing. Not much, only because it's painful. In other words, that knee has to bear weight. So if it's painful, he's not going to bear weight on that knee, and that swing is going to go.
Yeah, that's what he says. He says, my pain is on the outside part of the knee and hurts when I turn and drive the ball, just like what you said.
Well, he's describing a bow-legged situation. That's treatable, by the way.
Well, look at this, really.
Absolutely. Yeah.
Is that the Tiger Woods syndrome?
Oh, God.
Didn't he have a knee problem?
No, hip.
No, hip problem.
Yeah.
Okay, we're going to take a little break, guys. So if you want to give us a call, the number is 877-927-6969. If you're embarrassed or afraid to call Dr. Pinozzo direct at 561-381-5800. He will answer your call and tell you whether or not to come in. Have a great day. We'll be right back.
You're listening to Dr. Pinozzo's Sports and Medicine Hour with Dr. Anthony Pinozzo. If you have constant pain and want to talk about how to get rid of it without surgery or medication, or simply want a second opinion, call Dr. Pinozzo now at 1-877-927-6969 to get your pain issues resolved. And now, more of Dr. Pinozzo's Sports and Medicine Hour.
Do that.
We back again. Okay, Doc, here's one from a guy by the name Roberto from Del Rey. He said, I watched your show on Pinozzo.tv. I have a bad knee that I've scheduled to have operated on in 3 weeks. After watching the shows on your site, I think it's time for me to go see you. Well, let me give you the number so you can call and make an appointment, 561-381-5800. I've been told I have we spoke about this before, bone on bone, and that the knee is at a stage that cannot be repaired. My question is, why do doctors insist on using language like this? If what you say is true, they are not telling us the whole truth. What causes inflammation of the knee? I saw one show that said it may be lower back issue and pain is landing in the knee. Is this true?
No, that's not true.
I know we didn't talk about that. Okay.
No, these all pain is an injury.
Okay.
It just depends on what's injured and the location of it. There are knee injuries, and there are several things that will influence that. One is leg length discrepancy.
Mm-hmm. What is that?
Leg length.
The leg is longer.
Leg length.
Yeah, one doesn't grow
Okay.
due to injury in the teenage years. And it takes a long time for it to be symptomatic. Then the lower back can bother it only because of the way you walk, the hip, because of the way you walk, and you need a good diagnosis where the problem is, a source of any pain is. You have to have that. You cannot treat anything like for therapy or chiropractic or any of that stuff if you don't have a diagnosis. Mm-hmm. Now, when I see patients in the office, they've all been everywhere. The therapy, the chiropractic, and I say, what was your diagnosis? They don't know. obviously they didn't have it because they don't have a program for it, and
Right.
And you still have the pain.
they don't know where it is from, and
Yeah.
they're doing things like if you have a knee pain and you go to physical therapy, they're going to exercise your patella and make you worse,
Inflame it.
inflame it, overworked.
Then they put the ice packs on you.
Then they put the ice pack on. Forget ice pack, forget heat. Don't do any of that, and don't buy anything from the drugstore either. 'Cause
Oh, you
none of
mean
that helps.
you mean Tommy Copper and Bobby Schwartz and all those other guys?
Oh my God! What I mean, they have their what's a Jewish name?
Chutzpah. Chutzpah.
To put that stuff on. I mean, it's wrong.
Yeah, but people keep buying it. Though.
I know. It's just they believe
just ridiculous.
They're desperate. You know, if I can solve my knee problem for $19, I'm going to try that.
But it doesn't work.
It doesn't work. No.
No.
So,
But
at least-
for if you spend $19.95, they send you a second one for free. All you have to do is pay shipping and handling, which is about $35. But that's just me.
and then they put this copper into thread. Well, how in the hell does that get it? Excuse me.
No, you can say that. Hell is one of the words we can say, Doc. I'll
How
let you
does
know.
that get into? How does that get into the ligament, which is maybe 2 inches in thickness from the skin?
Yeah, but let me ask you:
You can't get it.
does copper really do
No,
anything?
no, it does not. No.
According to that show I watched, BS, a medical show, they said copper does nothing.
It does nothing. No.
Because if it did, I just take. Look, folks, I can save you a lot of money.
I can only tell you that when we do blood work, we do not test for copper.
Okay. Well, Freddie, I got a great idea. We'll take that big tape. We'll stick 30 pennies on it, and they can wrap the knee up in pennies. There's
Yeah,
copper.
that'll help. Yeah, same thing.
With duct tape.
A duct tape.
It's the same difference.
Well, you're getting a real thing, real copper.
Yeah.
I mean, but the atomic copper
Shiny
stuff
copper.
is not real copper.
We'll get new pennies.
Well, you know what really gets to me is I'm finding out. More I read about this stuff, the more I'd say. Well, let me tell you a story. I have a doctor who's a friend of mine, and I was telling him about my pain, and the first words he said to me was, "Les, do not go in for I forgot the word, physical therapy." He says, first of all, you're gonna end up worse. This is a doctor who's been a doctor for for 45 years. He said, don't do that. He said, first of all, they're gonna hurt you more, and you do that at the gym anyhow. Go see your friend, which I was just testing people to see who is smart. And I said, I already did. He said, yeah, I knew you did because you're walking better. I mean, so I say to everybody out there, this is an information show. We're not trying to sell anything.
You can buy my book.
Yeah, they can buy your book. They could go, Freddie, how do they find his book? Where do they go? PayPal?
They go to Panozo.tv and you order it right there online.
Right, go to Pinozo.tv and order his book right on the line and find out everything he does. See, Freddie sets all the stuff
Or
up.
go to Amazon. They'll send it.
Amazon.com?
Yeah,
You have a
Amazon.com.
student thing going on with Amazon. I don't know if you're aware of that.
What's happening?
With Amazon, you have a student thing. They get a half price if you're a student.
really?
No, I didn't know that.
Did you know that?
No.
I didn't think so.
Well, we got from LinkedIn. That's another website that we're using, and it's Mike from Tampa. He said, I watched your show on LinkedIn and was fascinated to see that you can fix a torn ACL. I will be watching your show today as I have been told I need surgery to repair my ACL. Can you explain how doctors only use surgery to fix this problem and you can't and you don't? What do you do that's different? You're a new fan. You're his new fan.
Well, this is an interesting question.
It
and
is.
We've had this
This is
discussion a
interesting.
lot.
Yeah.
The ACL only holds the tibia to the femur. That's all.
Okay.
It's a ligament. It's that long,
It's about an inch.
about an inch, and what they can't diagnose that because there's no symptoms for it. Now remember, the inside the knee is pain-free. There is no pain on the inside of the knee. You got to get this through your head that's where this ligament is. So how do you diagnose it? You don't. What they're diagnosing is patellar pain. And I think I think no one should have their ACL touched.
Mm-hmm.
My niece was a runner, and she was trying to be sold that bill of goods, and I said, forget about it. It doesn't have much meaning for it. You don't even know it's there. It's mainly patellar pain, which is climbing steps, getting off out of a chair, and walking. That's all patellar pain.
And you can fix that.
And we can fix that.
Okay, this is great. Now, something that I read again. I'm going back and forth, so a lot of people that didn't know you were on the show. I was looking about hip surgery, and it was over how many was those? 565,000 hip surgeries performed last year, and this is what I read: you're in the hospital for 2 or 3 days. You're on heavy medication. There's no guarantee. Now, doc, no guarantee. You guarantee you come in with a pain, that pain you will fix.
I will guarantee it. Yeah.
Okay. Wait a second, Fred, you hear that word? He guarantees it. But
I know. That's why I went to see him.
Yeah, what does that mean?
It means that you tell
It
me.
means that if you have a pain after my treatment, we'll re-examine you. In fact, you get examined every time you come in.
Right.
I mean, it's not we know how to do that. Then that pain will go from place to place, which we chase it off, and then you're done. Once you have a range of motion that's normal, I mean, you can move without a pain, and you're done. That's what we mean. We guarantee that because we know how to check it.
So in other words, you don't give dope, medications,
Oh,
drugs,
no medication whatsoever.
So if someone comes in and says, I'm having pain, could you prescribe something to me? You
No,
say,
the best one is aspirin. So you don't need a prescription for that.
I had pain in my neck. I told my wife to leave. No, I had pain. I took an aspirin.
You take an aspirin, right?
And you know what all the doctors that are smart say? Stay away from Tylenol.
Yes.
It could cause you problems in your
Tylenol
liver.
that is not as good as aspirin.
No.
You know why people take Tylenol? It's
No.
advertising. You have to be very careful what you're looking at.
Right.
They're after your money. All these advertisers, including me, when I advertise, we're trying to be busy, but at least we're ethical. We have something to
Oh
offer you.
yeah. I mean, it's here's what they say. Even though you have the surgery, walking becomes harder when you have hip surgery. It's very very minimal.
Well,
chance.
here's what happens. They take your hip away, which is a ball and socket, So your pelvis is here and your hip is here, and it moves like this. So they take that out, and then they shave that down, and then they screw in a cup, and the new hip goes into the cup.
Oy.
Now, there's no pain there whatsoever. It's titanium, I think.
Yeah,
and,
titanium.
There's no way to hurt that. Where is the pain then?
Around the injury.
Scar tissue around it. That's where
right.
the pain is.
That's
your tissue. The hip, the new hip is not your tissue. That is not going to bother you. It's around it, your tissue, and that's all treatable. So when they talk about all these hip failures and they're suing this company for the design and all that, that's baloney. That's baloney. They're not examining that.
Well, you see that all over the. They're coming out with. Have you used a so-and-so hip replacement? Call 800 pain.
Yeah. So what's the proof of that? Where's the exam? There isn't any. They don't examine. They're going right to the lawyers. I mean, it's just a tragic situation. These companies are paying through the nose and increasing costs for all of us. Remember the breast implants?
Oh.
You had something that was inert. You know what inert means? It means there's no reaction chemically to it. So your body doesn't even know you have it in there. It's inert. It doesn't do anything. And all the lawsuits that went through with that.
Oh, the first time, it was amazing.
The lawyers got a hold of that, and you can't believe what happened. And it costs more for all of us,
I always get the thing when the lawyers made a multi-million dollars on people that were smoking. Smoking is bad. Something's going to happen to you. Why do you do it? Now you sue somebody when they tell you. Okay.
They tell you don't smoke, so you smoke more.
We got a lot of stuff from our tweeted people and everything. This is a busy Michelle from Jupiter. Michelle, you're not that far away from Dr. Pinozo, so I just want to let you know. In case you want to call him direct, it's 561-381-5800. And here's what Michelle wants to know, Doc. My oldest son is a pitcher for a major university up north. He has been informed that he needs Tommy John surgery, and I've heard your program before. Can you help? Well, I never heard of that. What's Tommy John surgery?
I have no idea.
Yeah,
that's the ligament.
Oh, it's an elbow.
Yeah,
she's talking about
reconstruction elbow.
Huh?
Reconstruction elbow. Tommy John was the first one that had it. They redid the elbow. He came back to pitch for another 5-6 years.
Never heard of that. Wow.
Well,
which what you're saying, Doc, makes a lot of sense because they go in and they reconstruct the tendons and the ligaments in the elbow.
It's a lot of baloney. I mean, hey, you want to know the truth? I speak the truth. Elbows are treatable if you know how. You don't need to reconstruct it, and you don't need to rehab it for 5 years or whatever they take.
It takes 1 year now. It used to be 2, now it's 1.
Wow, a year.
It takes a whole year off. Yeah.
Yeah, and they still get paid for that, and it's not good. It's not a good thing to do, and you don't need it. I treat elbows. You don't need any surgery. There's no surgery to be done.
Well,
You
whoever
cannot
invented that,
break a tendon. It's very difficult to break a tendon. But the pitchers have trouble with their shoulders, which we do. We do a unique examination for that. It's based on the anatomy and the physiology. It is not a copy of whatever the orthopedists do. This is strictly new to us. We produce this, and we treat a shoulder. If you can't sleep on a shoulder, one treatment you will sleep on it.
Really?
That's right.
Well, here's another one from our Twitter followers. Elizabeth from New Jersey. I watched your show on Twitter. Twitter, I'm sorry.
Twitter?
Twitter. My God, you have us all over.
How did we get on Twitter?
Freddie, I mean,
we're everywhere.
We got a producer here that knows what the hell he's doing. And I said it, folks.
Yay, Freddie.
And we're shocked that someone like you, meaning you, Dr. Pinozo, exists. I have a serious case of joint pain in my hands. I was a seamstress for 45 years, and the doctor I have said I have arthritis. Can your procedure help me? Well, first, before I say it, Florida is a great place to come to this time of year. The weather is beautiful out there. So, Doc, can you treat this?
Yes.
Okay. Why is we spoke this morning about arthritis?
Well, we don't really know what this person has, but if it's joint pain, all these little bones you have are held together by ligaments. This is a ligament problem. Those are all treatable and treatable quickly. 1-2 days, that's it.
Wow.
The wrist has 8 bones in it, each one. They all are connected by ligaments, so you can see what the problem could be. What was she, a seamstress?
She was a seamstress for 45 years, so I guess she was always using her hands.
Well, she's probably got wrist. Well, if she knits, she's got wrist problems. Yeah. But anyway, we could do an evaluation for her and we knock out the worst ones. The way we do it is we do an examination. We figure out which is the worst pain of the day, knock that out. The next time you come in, it's a secondary pain. Re-examination, find a new place. These are cures, each one. I mean, somebody's saying, now, how can that be? Well, it is, because we have a reason for it to be. These are ligaments that are scarred down. If you know how to diagnose it, then you can loosen up each one. And they don't go back again either. Those are cures per ligament. Not the whole thing in one day. You can't do that.
No, of course not.
There's too many parts. But it's good. You see the difference. We don't have many people who are unhappy.
I've been with you now for a year, and I haven't seen one person in your office or anyone that I know who I've sent to you have ever said they were unhappy.
Well, you know what? People in the waiting room, it's like they're cheering for each other.
Yeah.
If they have a pain for a long time, those have been there try to satisfy them. Oh, it's not going to be so bad. You're in a good place and all that. And so they come in, and when they come out, they raise their hands, like a V.
Well, when I first...
I mean, it's really comical.
When I first saw it with you, I saw a guy came in with crutches and knee things. As they progressed, I saw him with a walker, and now he comes in with nothing.
Yeah.
First of all, I always get the biggest kick out of this lady from England, Freddie.
Yes.
Who was told, I know if you've heard the story, again, don't listen to it, but there's so many new people coming that are turning into the show. She had scoliosis and was told the rods came into you, and we have, anyone that doesn't believe this, we have documented proof. If you want to come in and just see the proof, come on in.
Well, on that commercial, well, we have it on
commercials
that
running. Yep.
There is a change on that, and it is true. That's right from the archives.
But let me ask you a question. Again, I'm playing devil's advocate. Why would they put rods in people when you exist? Why?
They don't know about it because I did the research.
Isn't that amazing?
The research was done right here on Delray Beach.
Yeah.
And it's true. It works. Absolutely works.
And it's amazing. I mean,
why more people don't get that? These young girls are making a big mistake.
You're dealing with a 15-year-old right now.
They're making a big mistake when they don't want to come in. They argue with their mother. I mean, and they're listening to other people what does he know? Somebody else in Georgia knows more. That is not true.
No.
That is not true. Our results come in daily. You could see yourself turning. I mean, you see it on film. You see it on our C-arm, on the scope there, which stores images. So you can see your first image, 2-minute image, 3-minute image, 4-minute image. You see them all right there. You go click, 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 and they show up like that. And you can see the change right there in front of you.
You're going to feel the change.
And you feel it, too.
Absolutely.
I mean, we've seen it. I mean, to me, it just bugs.
And is there any downside? Absolutely not.
None? No.
I am not a plumber or a street cleaner who happens to practice medicine on the side. This is what I do for a living.
Well,
and this is the very best you can get, and I'm not kidding when I say that.
I mean, I had 2 shots. It wasn't there wasn't any problem. I didn't have a rash. I didn't do anything. All I know was I slept for the first. I mean, to me, look, I would say that your shot is 100 times less painful than a shot of Novocaine.
Well,
in the mouth.
So someone would say, well, why do I have to have a shot? And there's and it's dangerous. So they're not dangerous. No. There's no downside to it. You cannot get hurt because I know the anatomy. If I, like I said, I'm not a street cleaner. I'm a real physician, if you believe it or not.
And a real doctor, right?
Yeah, a real doctor. And so we do research all the time, and this comes out of our research. And it is true. We actually turn that bones, and you can see it for yourself right on the screen.
Turn people's lives around.
Yeah.
Here's something that also, I'm going to skip some of these questions because this one, to me, is very important because I've seen it more than once about migraine headaches. And to me, that sticks home because families are devastated by migraine headaches, how bad it is. In fact, Carlos from Jupiter writes on see if I do this right for you, Twitter. He writes on Twitter, I watched your show on Twitter and was amazed that you have been around so long and I haven't gone to see you. I suffer from a long-term migraine headache and I've tried everything. My sister retweeted your show and I watched it twice. Can you explain how migraines take place and why is it such a simple diagnosis and why don't doctors know about this information? Great question.
The headaches are a headache is a symptom.
Okay.
So it's a what we call a referred pain. In other words, your shoulder could hurt and you'd feel it down a little bit further. That's a referred pain.
Okay.
It's not coming from there, but it's coming from somewhere. So same thing with the headache. You have a headache. Yeah, we've done this. Last week we just did this. You could have sinus headache. You have TMJ headache on side. You could have neck pain here and migraine there. And that's all there is. So forget about the rest of the talking about cluster. I mean, the whole thing is bizarre.
What the heck is a cluster headache?
Who knows? That means you get 2 or 3 in an hour or something. It just doesn't make any sense. If you know where it's from, it's treatable. So the neurologists really dropped the ball on this. They don't have a clue. I just saw just last night a long commercial, more than a minute, for Botox.
Oh, yeah, they run 90-second commercials.
You cannot treat migraine with Botox. Botox only treats muscles. Muscles are not the cause of headache. It's ligament.
Well,
got it? Ligament.
Do you know what Botox is also advertising? Women have overactive bladders. They give Botox shots, and that's the one I'll never understand.
Now, where does migraine come from? It comes from COC1 at the top.
Oh, we got a call from Paula. Hold on, Paula. We'll get you right now. Hi. Oh, hi, Paul. How are you? Paul? Hello?
Hello.
Hi, Paul. You're on with Dr. Pinozzo. If you have a question.
I do, actually. I was in your office about 3 weeks ago for some shoulder pain that you treated, and it's gone, and I'm going to come back for some other pain. My question is, I got a flyer in the mail yesterday from a place called Laser Medica.
Never heard it. Go ahead.
What's your opinion on that?
Well, I don't know what they're talking about. Laser is just infrared light.
So it's really not going to do anything?
No. It goes back to the diagnosis. If you have a diagnosis, you can get treated, but not with a laser. You have to know where it is. Usually the ligament, and you have to know where it is. And it's everything's treatable if you know where it's from. That's the whole deal. When you have a failure in treatment, even in my office, I missed it. Well, in your case, I didn't miss it, evidently. Thank you.
No, you didn't. No,
No, thank you. I appreciate that.
I will be back shortly for some other stuff. I was just curious about that. That's all I got.
Isn't it amazing that people send out things about lasers and they can cure pain and la la la, and people
Hey,
will.
Paul, thank you so much for calling.
Well, laser spine surgery. Was it?
Laser spine.
Laser spine, yeah. Well, that's another
myth.
Another myth, because laser has nothing to do with it. It's a light.
Yeah. Well, you know, the bottom line here, Doc, so that people understand, this isn't like taking a flu shot. You go and you take a flu shot, it takes care of the flu. You are specific where you put, what you do, and how you do it. Specific.
Yes.
So this gentleman had a pain. He went in to see 3 weeks ago. The pain is gone.
Well, first of all, we showed him where it was.
Correct.
And when I put my thumb on it, and he says, "Oh, that's my pain." Okay, we know where it is. This is what I want to do for it. And they usually say yes, and I do it.
Excellent.
Well, I have one. I don't know. Susan from New Orleans, a friend of mine that lives in Florida, sent me a show on Pinterest. I said that one right?
Pinterest, correct.
Pinterest, okay.
Pinterest.
Well, before I take this call, okay, never mind. I thought I had to call company. Okay. And she said, you spoke about scoliosis, and I have this condition. My friend says that you actually can remove the curvature and pain that comes with this condition. Can you explain to me why my condition gets worse over time, and I am 54? Is it too late for you to help me?
It is not too late, because any age is treatable. Because what it is scar tissue between your bones.
I'm going to have to stop you right now, Doc, because Dr. Paul is on the phone.
Dr. Paul.
Dr. Paul. Here we go with Dr. Paul Pinozo, I think.
My son. Yeah.
Is he on?
Hey, Paul, how are you?
Terrific. How are you guys today?
We're doing great. How are you doing back there?
Paul.
Wonderful, wonderful. What's the topic?
Well, we had so many topics today, and we just had a great one. Someone went on one of our many websites.
I was just explaining what scoliosis is and how we treat it. Are you seeing much of that?
Plenty of it.
Really?
People, pretty commonly, people have a curve as a cause of their back pain. You know, that's where they bear the weight, where they pivot. All motion kind of happens more on one side versus the other, and they become symptomatic. You bet.
Yeah. So we're having a good discussion on that, Paul, and I'm trying to explain that you have to know where the ligament scarring is. These are all from injuries, which is holding those bones in that position. Now, if you understand the body wants to be normal, and it will be normal if it can. If it can't, then it's because there's scar tissue holding it. And so we know where it is. We put a shot in it, or other methods that we have, and it straightens up right on the C-arm. You can see it.
It's funny, Paul. We had a lady that went on. We have so many websites out there. She went on one called Pinterest. I doing it right, Freddie?
That's correct.
And she had said that she saw this show, and she said she's 54 and she wants to know, is it too late to help? And that's why I stopped when Paul was on the phone. Is it too late to help at 54?
No, we know we have the techniques to treat. We treat older people too. I treat an 89-year-old with that 94. Oh, 94-year-old. That's the oldest now. And she came in because of a pain, and we're straightening her scoliosis right out.
Well, now they got the two. Now I got the two of them on the phone. Here, I have a question for both of you to see how you want to handle it.
Good.
Paul, not you, from Port St. Lucie. I've been scheduled for hip surgery. The doctor says my hip is at a point that if I don't get surgery, I will walk with a limp and pain for the rest of my life. I've asked other doctors to give me a second, third, and fourth opinion, and they all say one thing: I need surgery because my hip has degenerated. Is this true, and can you help me? Guys, go ahead.
Go ahead.
I would say if the hip looks like if it's no longer looks like a ball, if it doesn't move, sometimes you have to have that replaced. But if it's, if it's still on the X-ray, still looks good, you can get some range. We've seen the gamut over time. Seen people say they've been told they need to have a hip replacement, but the hip moves normally. So how can that be? But we've certainly sent people for hip replacement when there's, you look on the X-ray and it doesn't look like a ball anymore. It looks like a square. So, it's.
Well, when you examine, there's a limit on these symptomatic hips. There's a limitation of motion, and what that is a ligament structure not allowing it to move. That's where it is. Remember, inside the hip, no pain at all.
Right.
Just like inside the knee, no pain there. So, so if you examine it right, you can find a ligament that's symptomatic at that particular day. And that's treatable, and next time you see someone that's not in there, it's another place. So it's a progressive deal. It does work, and is a ligament problem.
Paul, are you how you do with migraine headaches? Are you able to relieve the same thing your dad does with his migraine people?
I do very well with headaches. It's generally the highest few levels there. The one that's missed the most is the joint between the neck and the head.
Mm-hmm.
That does more than a few chronic headache. Most people get the first couple of set joints, the 2, 3, 3, 4. That's pretty well known. But the ones that they miss are the higher ones in that. But yeah, headache is
actually Paul did the research on that.
Well, let me tell you.
So I was musing about it, and I called him up in Arizona, and I said, "What do you know about this and this and this?" And he said, "I don't know. I'll look it up." He calls me a week later, and I said, "Can you inject it?" He said, "Yes," and he did. And
amazing.
That's how we did the research. So it was a collaboration, and. Yeah, it works.
Well, we've seen, Paul.
But it's 100% effective. If you can get that injected right, it's 100% effective.
I know.
No drugs, nothing to do.
Well, we've seen that with 6 patients. We got a commercial running.
You get up from the chair, and after we do it, and my headache's gone. That's what people say.
Paul, did your dad tell you about the gentleman that came in who spent like over $36,000 in 1 year trying to get rid of a migraine headache? And he gave him the shot, and he was sitting there as we were interviewing him. Says, "Oh wow, it's gone. Is it going to come back?" He said, "No." So I said, "Doc, you give them a shot, they don't come back. What's going on here?"
Yeah, that's true. He wanted to do a commercial for me, so we
did it.
Recorded him right after that, and it was not prepared. Nothing.
No,
was
he
said.
just spoke.
He just spoke. And that's the best kind of thing you can get. So,
well, did you tell your son about the guy that called on another show, raving about you?
Oh, no, I haven't got a chance.
Well, I'm going to tell you right now, Paul. You want to hear it?
Sure.
One of the talk show personalities that does your dad's commercial, a patient actually called up thanking the personality for what he had done for his daughter. Why don't you tell your son while we're on the air? It's always good to repeat that. A girl came up with a crutch and 2 knee things or 2 braces.
A 14-year-old girl, she was wearing a brace and using a crutch, and both of which we don't like. I don't like those things. I think they make you worse. Anyway, she had valgus knees, which means the leg, the tibia isn't straight. It goes off to the side. And that's scar tissue around the outside of the knee.
Right.
Remember, that's where all the pain is. So so we treated that, and he was most grateful. And
he called up?
He called up and thanked them for the referral.
We're getting a lot of that lately. A lot of people calling up and telling how grateful they are that you're alive. Where have you been all their life? Well, gosh darn it, folks. We're not lying. This stuff works. I've been a patient. Freddie's been a patient. Half the people we know have been patients.
Paul doesn't know this, but we're on Twitter and
oh my God.
Pinterest.
We're on Twitter.
Now, this is all new to me. I'm hearing it for the first time.
Well, guess what, Paul? I'm hearing it for the first time. My producer's so busy doing these things, he doesn't tell me anything. Freddie, tell me.
There's plenty more. There's plenty more.
He's on LinkedIn. He's on Twitter. He's on Pinterest. He's on Pinozo.tv. And he's on, you ready for this one? Time to Play Golf website.
Time to Play Golf Is it .com?
.com.
And what happened, Paul, is we got 3 people that wrote in asking about golf injuries, which to me is fantastic. So whatever Freddie's doing, Freddie, thank you so much for getting the word out for Dr. Pinozo.
Well, you got plenty of other sites, Dig and stuff like that. LinkedIn. I mean, you're all over the place. There's a couple of Japanese sites here on that as well. But I want to tell people that we're going to be filming. We're going to be filming tomorrow. We're going to be at Dr. Pinozo's office tomorrow at 9 o'clock. Come on down. Let the doctor take a look at you. I know we didn't get any calls today, but if you can hear our voices, give me the address. Celeste, come on down. We'll be there from 9 to 11.
The address is 16244 Military Trail in Delray.
Come down and tell us your story.
Yeah.
Let the doctor look at you if he can help you, which 90% of the time I've never him
I haven't
turn
seen
anybody
one.
away.
I would go to 99% of the time, to be
No,
honest.
I don't want people to think he's perfect.
Well, he hasn't missed yet.
I know that.
Paul, thank you so much for calling up. We're going to be hanging in about another minute. Do you want to say anything about your successes and give out your number so people in the area could call you up?
Yeah, give your number.
Give
out,
your
Paul.
number and your address of your main office.
All right, 623-776-8686, and we're in Phoenix, Arizona.
Okay, could you give the number out one more time?
623-776-8686.
Paul, thank you so much for calling in. Have yourself a great day, and maybe we could talk to you again next Sunday.
You guys too. We'll talk to you.
Take care.
Thank you.
Bye-bye.
Well, and your son is following in the footsteps of his dad, helping a lot of people.
It's nice to have a collaboration, which is really good.
Well, it's good because the two of
When
you
he
get
went-
together.
When he went to school, he got the usual training, and they wouldn't do what I was doing, which is basic research. It was based on the anatomy. How was it designed? What goes wrong with it? People use MRIs now. That's not the way to diagnose things. You can't use an MRI. You got to know what you're talking about. And so it's been good. And so after the training he had at where he was trained, I taught him how all the techniques, and we started doing research together and wrote a book together.
Well, that's the young and the young, and it's like that's the grasshopper, and you're the major guy. No, really, it's grasshopper. Remember that? Well, who was that? Kung Fu, right? Wajon. But it's true though. He's wearing the stuff that he was taught at college.
That's been the Dr. Pinozo Sports.
And I want to say to everybody, thank you so much for tuning in. We'll see you next Sunday.
All right, see ya.
Have a great day, everybody. It's a beautiful day out, and goodbye.
Dr. Pinozo online at www.paincentersnationwide.com or call him at 561. Solution to your pain needs. 561-381-5800 is the number to call, even if it's just for a second opinion. Join Dr. Pinozo next week when he brings you more important information on the physics of weight-bearing and engineer concepts for the body.